Cancer treatments such as chemotherapy and immunotherapy are given in specialist treatment centres. Staff in these centres are very experienced in preparing and giving these treatments. Please speak to them if you have any questions or concerns, as we aim to support you through your treatment and provide high quality care that meets your individual needs. We have plenty of information and support available to help you. In this film, we will be explaining what will happen in the days before your treatment and on your treatment day. Before each treatment, you will need to have a blood test. This is to make sure your blood results are at the right level for you to be given treatment safely. There are a number of locations where blood tests can be taken, and we will discuss the best location for you. Blood tests need to be taken on a specific day before your treatment. Please have yours on the day advised by your treatment team. At your first outpatient appointment, we record your height and weight. Cancer treatment doses are tailored to the individual patient, and this information is needed to do this. You may need to be weighed before each treatment as part of your outpatient assessment to make sure your dose is correct for you. Once the treatment team have your blood test results, they will check them and prescribe your treatment. If your blood levels are okay, the prescription is then sent electronically to the specialist pharmacy unit that makes the treatment. If your blood levels are outside of normal range, you may need to have another blood test on the day when you come for treatment. You will be told if the blood levels are out of range and what the next steps might be. Weston Park Hospital and Burley Medical Centre do not have departments for analysing blood tests, so these samples are sent to the Royal Hallamshire Hospital for processing. They are sent by a quick delivery pod system and are given urgent status. The laboratories try to have the results available within 1 hour or 2 hours, depending on the blood test. However, occasional delays do occur. Each treatment is made to measure for you, based on your height and weight and the side effects you may have experienced with your previous dose of treatment. Some treatments can be made the day before it is due and may be ready as soon as you arrive. Others have a short expiry time and can only be made once you are on the unit. If you need to have a repeat blood test, the treatment will only be made by pharmacy after they have checked the results. This can take a while, so please allow extra time for your appointment if this occurs. Planning and booking treatment appointment on the units needs to take into lots of different factors. There are over 100 different cancer treatments, and each one takes a different amount of time to be given. Our appointments are planned to provide patient safety, so the time of appointment cannot always be changed. If you have exceptional circumstances that means your appointment time has to be changed, please speak to the treatment team. Sometimes it can take longer to give your treatment than planned. There are many reasons why this may happen, but please plan for this. Try to avoid having other appointments or activities planned for immediately after your treatment time. Before you come for your treatment, make sure you have something to eat and drink. Please take your regular medications and bring any that you may need throughout the day, such as pain relief or insulin. We advise that you do not drive yourself to your first treatment appointment, as you may not feel well enough to drive afterwards. You may have been asked to take some medication before you come for your treatment. This is often given to prevent or reduce side effects of treatment and treatment reactions. Please take these as advised. If you have not taken this medication, please let a member of staff know immediately, as this may delay the start of your treatment. On the day of treatment, follow the directions to the unit on your appointment letter. If you're having treatment that takes more than 1 day to be given, you will have this on one of the wards at Weston Park Hospital. Before you start your treatment, you will be seen by one of the nurses. They will ask some questions to make sure you are well enough to have your treatment and see if you have any concerns. If you need to have any further checks, such as blood tests, blood pressures or temperature checks, or blood glucose levels, the nursing team will carry these out. The treatment units are led and provided by experienced cancer treatment nurses. This means that doctors from the cancer treatment team do not work on the unit. If a problem is identified that needs a doctor's advice, the nursing team can arrange this. As the doctor will have other responsibilities in the hospital, this may take some time. If your treatment cannot be given before a doctor has been consulted, this may increase your waiting time on the unit. If you have a problem or a side effect that is causing a concern before your treatment day, please seek advice. Contact the advice line on the number you have been given. If you wait until your treatment appointment, you may not be able to have your treatment as planned. Your first appointment may be much longer than your following visits, as we check your consent and ensure all your additional checks have been completed. We also check that you understand what treatment you are having and the risks and side effects you may experience. If you have any changes in your symptoms since you had your outpatient assessment appointment, or you have any new problems, please tell the reception staff when you book your appointment so they can alert the nurse to see you as soon as possible. Sometimes we may be late in starting your chemotherapy, as we are waiting for a treatment chair to become available. If other treatments are running late, there may be many reasons for longer than planned waiting times, but please be prepared that you may need to stay longer on the unit than your allocated appointment. Please talk to your nurse if you have any questions or concerns. All of our nurses who give chemotherapy or immunotherapy have received additional training and are very experienced in giving these treatments. Most treatments given on the day case unit are given intravenously. This means they are given into the vein, often through a thin plastic tube called a cannula. The nurses on the unit have received training in placing the cannula into the vein, called cannulation. They place cannulas frequently and are highly skilled in doing this. Despite their level of skill, cannulation can sometimes be difficult. In some cases, it can be hard to find a vein, particularly if someone has received lots of treatment in the past. It may be necessary at times for the nurse to ask one of their nursing colleagues for assistance. You will be told about how to care for your cannula and how to protect it from becoming dislodged. If cancer treatment accidentally goes out of the vein and into the skin and tissue around it, this can cause a very serious skin damage. This is called extravasation. It is especially important that you tell us immediately if the cannula becomes painful, tender, or leaks. We will remind you of this on the day of treatment. When there are problems with placing a cannula, some patients can be given a line that goes into the vein called a PICC or Hickman line. These are semi-permanent lines that stay in for the course of treatment. If you would like to know more about these lines, please speak to your nurse who will provide you with more information. Some patients require this type of line because of the treatment they are being given. This will be arranged before you attend for your first treatment. Allergic reactions. There is a small risk of an allergic reaction to your intravenous cancer treatment. If left untreated, these can develop into a serious allergic reaction called anaphylaxis. Reactions can happen quickly. If you start to feel unwell during your treatment, report this to a nurse on the unit immediately. All staff on the treatment units are trained to deal with allergic reactions. If you have a reaction, you may need to be given extra medication and you will need to stay on the unit for several hours so we can make sure you have recovered. The nurses will give you more information about this when you come for your treatment. Tea and coffee are provided in the morning and the afternoon, but please bring snacks if you feel you may want something to eat. If you are having a long day treatment at Weston Park, lunch will also be provided. Please be aware that we cannot refrigerate or heat up any food while you are with us. Facilities are available in the units and the nursing team will tell you where these are located. Due to limited space and patient safety, could we ask that you attend your treatment on your own? If you require additional assistance, please speak to the nursing team on the unit. As part of your treatment, you may be prescribed other medications to take home. These include tablets to help manage side effects from your treatment. All your medication will be explained to you by one of the nurses or pharmacy staff. We aim to ensure that these medications are ready for you upon completion of your treatment in the unit. However, it may take pharmacy some time to prepare medication, particularly if these are requested on the day of your treatment. Before you go home, your next appointment details will be given to you. You should also be given an alert card which contains the telephone numbers to call and a symptom diary. You will have been told the common side effects of your treatment for you to look out for the days and weeks to come after your treatment. The diary contains information about how to recognise the side effects and what to do. We hope this has helped you understand some of the steps of your treatment. If you have any concerns or questions about your treatment and how it might affect you, please ask. We have plenty of information and support available to help you. Please watch our films about side effects of chemotherapy and immunotherapy and are living well on treatment.